Hi everybody, it's Dr. Beard, and I want to talk about something that's been on my mind because I keep seeing new patients come to me who are on statin medications for what I consider very normal cholesterol levels. And so I just want to go over the side effects of a commonly prescribed statin, pravastatin. So these are the serious side effects that they're stating. Okay, sometimes they don't state everything, but these are the ones that they are admitting to. So the serious side effects are myopathy, tendon rupture, rhabdomyolysis, which is basically a breakdown of your muscle, renal failure, liver toxicity, pancreatitis, lupus, vasculitis, polymyalgia rheumatica, low platelet count, low white blood cell count, hemolytic anemia, interstitial lung disease, and several other autoimmune diseases were listed. So those are the serious side effects. The common side effects listed were musculoskeletal pain, myalgia, diarrhea, upper respiratory infections, flu syndrome, vomiting, headache, chest pain, rashes, dizziness, cough, asthenia, dyspepsia, elevated liver enzymes, elevated glucose levels, remember that one, and cognitive impairment. And personally, I have seen many of these side effects in patients on statin medications. I took my father off of his statin 15 years ago because the poor man couldn't even exercise anymore because his muscles were hurting so bad. And he's not had any problems since. In fact, is doing a lot better. So, if you want diabetes, take a statin. And I see this happen all the time. People get placed on statins for high cholesterol, and all of a sudden they're diabetic. And it's because of the statin. Statins are very harmful to the mitochondria. Mitochondria are the powerhouses of all of your cells, except red blood cells. Red blood cells do not have mitochondria. Mitochondria are organelles in your cells that produce the energy the cell needs to do whatever that cell was designed to do. Statins do a number on the mitochondria function. They just cannot function like they're supposed to, and thus you have all of these side effects. Now, back in the day, 220 to 240 was a normal cholesterol. We didn't get upset about that. That was a good thing. And now all of a sudden it's 200 or less. And even then, if you have a family member who had cardiovascular disease, they want to put you on a statin for preventative purposes. Do not fall for that nonsense. Please do not. And a lot of studies have shown that cholesterol levels at around 240 help a person have optimal cognitive performance. All right, so a level of 240 means that you will likely have much better cognition. And what do they want us? They want us at 200 or below. And some cardiologists and doctors are just fine if it's like 100. And I've seen these patients. And these patients were men with zero testosterone, couldn't hardly move because their muscles hurt so bad, and were depressed. But yet their cholesterol level was low, and so that was a good thing. Makes no sense. And so here's some of the things that cholesterol does for your body. Before you keep viewing it as the enemy that mainstream medicine has made it out to be, consider this. Cholesterol helps maintain the structure of cell membranes, and cell membranes control what enters and exits the cell. So every cell in your body has a cell membrane, and cholesterol is a component of that. Cholesterol is a precursor for steroid hormones like cortisol and aldosterone. Aldosterone helps regulate your blood pressure. Cortisol is a stress response hormone, which you need. Not too much, not too little, but you absolutely need it for your body to function right. Cholesterol is also a precursor for sex hormones like testosterone, estrogens, and progesterone. So, if you got a lot of hormone problems and you're on a statin, maybe it's time to get off of that. Cholesterol is also a precursor for vitamin D synthesis. You have cholesterol in your skin. The sun's rays hit your skin. Vitamin D is synthesized. And most of you probably are well aware of all the benefits of vitamin D, which is not really a vitamin, it's a hormone. And that's a whole other topic that we can get into one day. Cholesterol is also a precursor for bile acids, which help digest fats and help you absorb certain fat-soluble nutrients. Okay, that sounds pretty important, don't you think? Cholesterol is also a precursor for the production of immune cells. And the last one that I'll mention is something that doesn't get brought up very often, but cholesterol and its metabolites greatly influence bone homeostasis. So if you are someone who has osteopenia or osteoporosis, make sure your cholesterol levels are not low. All right. And also make sure your vitamin D levels are not too low either, because both of those are greatly influencing bone density and bone strength. So let's just, I want to mention some other facts to you, because cholesterol has just been deemed the enemy. It is the reason for all the plaque that we have in vessel walls, cardiovascular disease. You have all this plaque buildup. Well, cholesterol only makes up about 11 to 14% of the actual plaque. All right. Cholesterol happens to be at the scene of the crime, but it is not committing the crime. Cholesterol is not causing cardiovascular disease. Cholesterol is recruiting cells and transporting cells to the area of damage in the vessel wall. And that's a good thing. You want that to happen. Okay, there's damage to the vessel wall. Cholesterol comes in, brings some other cells and patches it up. Okay, so that's good. So what is causing the damage to the vessel wall? Inflammation and hyperinsulinemia. Those are two of the biggest drivers right there. And inflammation has a lot of cause. There's a lot of different types of inflammation, a lot of different causes. All right, but that's a big one. And all these carbs and sugars that people are consuming these days is contributing to the plaque, to the damage, I will say, to the damage that is occurring to the vessel wall. All right, stresses, poor sleep, toxin exposures, all of these things are causing inflammation in the body and are contributing to plaque buildup. One of the last things I wanted to mention is that there are times when cholesterol is really high, like it's over 300, approaching 400, and I would say that is not, that something is off. And what I have found when people who have such high levels of cholesterol, in that 300 to 400 range, is that they are toxic. They have a high toxic burden, and I have seen this play out in many, many people who were doing all the right things, eating well, exercising, managing their stress, getting good sleep, but they still had very, very high cholesterol levels. And lo and behold, we find out that they have quite a few toxicities. And this can come in many forms. Air pollution, we know there's lots of research on this too. Air pollution increases your levels of cholesterol. Lead and other heavy metals do that. PFAs do it. And agricultural pesticides. Who would have thunk, right? And in fact, the ones that the patients that I have seen this really high cholesterol pattern with, cardiovascular disease, but yet are doing a lot of the right things, guess what they do for a living? They're farmers, they're welders, or they work in some type of industry where they're exposed to a lot of toxins, or they were born and raised in big ag areas, or row crops, like myself. All right, but so cholesterol is being produced to deal with this toxic state and these high toxic burdens. All right. One of the last things I just wanted to mention is over half of the people who have heart attacks have normal cholesterol levels. Okay, so What's with the other half? It's inflammation. It's high toxic burdens. All right. So if you're on a statin, I would highly recommend that one, you stop taking it because it is not helping you. If you have plaque buildup, you need to uncover and address the reasons why. Because if it's, it's inflammation, it's high toxicity, it's hyperinsulinemia, that if that's going on, plaque is just one thing you're going to worry about. These things are also going to cause a lot of other issues in your body too. All right, so I hope that cleared some things up. Maybe gave some of you some peace of mind who have made the decision not to take a statin, which more and more people are choosing to do. But there's still some of you out there that are being bullied by your doctors and scared by healthcare practitioners in the conventional medicine model that, somehow, you're going to stroke out or die if you're not on a statin medication. And that's just, they are demonizing the wrong thing. All right. Hope you liked it.